Okay.
I've been chasing her for a really long time.
Good. I'm glad to hear that. This is April 6th. This is Terry. Terry comes to me with pretty bad low back pain.
Yes.
It's coming down this leg, correct? And
Left side.
Left side. And you told me that you're having trouble, especially getting up, right? Getting up and down.
Well, not as much right now. It's standing.
Standing.
Yeah.
Okay.
That's the worst problem.
Well, let's see you get up and walk to the door,
Okay.
please. And come back and sit down on the chair.
And what with the chair?
Sit down.
Sit down.
Yeah. Okay, and I have your permission to video you and post
Yes, you
you
do.
on YouTube.
Yes.
Thank you very much. Okay, just a moment ago, before I did anything in your mouth, I asked for the strength of this muscle, and I said hold, and I was able to bring it in like this, right? It was very easy, correct?
Correct.
Okay, and the same thing with this muscle, hold, it went in very easy. Now what I did was I injected number 1, where you lost the wisdom tooth, with some numbing medicine. And you haven't even gotten off the table yet. And I say, hold. And you can see I'm leaning into you. Hold. Okay. Also, you can come back here. Okay, so now, just a few moments ago, you had limited straight leg raising. I just want to see what you can do now. You were about here before, wouldn't you agree?
Yes.
Okay?
That's about it, but that's a lot.
That's a lot better. Get his face, so I mean, that's emphatic, right?
Yeah.
And look how easy it is.
Yeah.
Okay? You're not resisting me. And now let's check this side. Oh my God, that's much better, right?
Yeah.
Okay, that's probably about twice as good. All right, and now I'm going to take the camera. All right, now I want to take a picture of you getting up off of that table.
Oh, yes.
And walking to the door, please.
Right.
Oh, that's a lot better. That is really amazing. That is very amazing. A lidocaine shot to the gums, and I'm walking better.
Right.
I didn't think my mouth was that close to my ankle.
Go ahead and sit down there. All right, now you can stand up and walk to the door and come on back and sit down on the chair. What do you think?
The back still hurts a little bit, but I'm mobile. And I was not mobile before.
Okay, and you're probably in a state of shock right now.
Yeah.
How I could do something here
Yes.
and your
And-
back, and you're
and
like,
my
what about the
legs.
leg itching? You had a lot of itching in your lower left leg.
Correct.
Is that still there?
Well, that's been intermittent, so I can't really say.
Oh, okay.
This morning it itched quite a bit.
Understood. But the pain is much less.
Yes.
You're getting up and down. You got off of that table pretty easy.
Yeah.
Let me see you get back on that table. And lay down.
And he's giving me complex.
Yes. I think that's a lot easier than in the beginning.
Yes.
All right, now, why don't you get up and I'll show you what happened. Come on up. We're going to come over here to this trusty chart, which deals with teeth. And we just did tooth number 1, right there, wisdom tooth. This happens to deal, and oh, don't you have an issue with your heart, sir?
Yes.
You have a pacemaker, right?
Yes.
You couldn't live without that pacemaker, is that correct?
That is probably a correct
I
statement.
think you had 4 cardiac arrests and your wife resuscitated you,
Yes.
correct?
Yes.
Okay, you're blessed to have such a talented woman.
Well, she just used poor judgment, could have had the insurance.
But then she'd lose the humor. Okay.
Might have been a good deal.
All right. So you're dealing with small intestine, and look up here. What's that say?
Heart.
Heart. Okay. And let's look at joints. What's that say right there?
Sacroiliac.
Sacroiliac joint. How about that? I didn't even get near it, and look what happened.
Very interesting.
Okay. Does that help explain some things?
Yeah.
Good.
So I can hear better.
You just got off the table after I did your sacroiliac joints.
Yes.
Okay, walk to the door. And back. And sit down. And get up and walk to the door again. And what do you notice in your back now, or your legs or anything?
The back feels a lot better. The tension in the close to the groin is a lot less.
Okay. A lot by a lot. Would you say better than 60%?
Close to that, yeah.
All right.
Yeah.
That's good.
That's minutes ago.
And that yeah.
Yeah.
Okay, and that occurred with the injection of the sacroiliac, correct?
Correct.
All right, so for the viewer, I think you have an underlying problem in what was wisdom tooth number 1 in the
Okay.
bone. I believe you have
Upper right side.
I believe you have an occult infection there. We know that you have heart issues dealing with conduction. That tooth is connected to the heart, and I have found it frequently affecting the conduction system of the heart, especially atrial firing,
All right.
which is what you don't have, is atrial firing. Is that correct?
Yep.
That's why you need a pacemaker.
Correct.
It's also connected to the sacroiliac joint, and you got out of a lot of your pain, probably the majority of it, just when I did that. So if you came in this office with 10 points on a scale of 10 of discomfort, and 0 is no discomfort, and 10 points is what you walked in the door with, what do you have now?
Probably 4 to 5
Okay.
in the back.
Would you have expected that?
I was hoping for that. I think there's a difference.
Okay. To be honest with you, I would have been happy if I got you down to 1, but 4 to 5 are going to live with, because you're going to get that tooth looked after, correct?
Yes, sir.
Okay. Today's date's April 12th. This is Terry, who came to see me with really bad back pain.
Yes.
And show the viewer where it is, please.
It is, as you look at the back, it's where from fingers to palm, that's where the pain is.
Very, very good. I mean, not good that you have the pain, but at least we know where it is. All right, that's sacroiliac.
Yes.
All right, or thereabouts, and it's on your left side.
Correct.
And you've basically been crippled. You just told me, and your wife told me, that you've had to crawl on the floor.
Yes.
And that you
I have crutches now.
You have crutches.
Yes.
All right. And interestingly, last week, this is your second time visiting me. Last week, I found that you had a problem in socket number 1, which is a wisdom tooth. I injected that, and your pain changed dramatically.
Yes.
Did it not?
Yes. My gait picked up, and I was able to mobilize a little
How
bit.
long did that last?
It probably lasted 8 hours, at least.
That would be typical. It's it's a test only.
Right. Yeah.
And it suggests to me that there's an infection there, right? We spoke
Correct.
about that. And today you brought in your dental history, which I didn't have before.
Correct.
And your dental history says that you have a root canal in number 18.
Which was bottom left.
Bottom left, correct. Second molar. And I just muscle tested it, and it's positive. So I'm going to play around with that one too, with your permission, okay?
Yes.
Let me see you get up and walk to the door, please.
Okay.
Whoop, I almost went down. Sit down on the chair, please.
You get extra points if you get the Faraday picture.
Now get up. Okay, that's good enough, thanks. Now we just did your bottom left molar. You were weak very weak when you touched it before, right?
Yes.
And I just injected it with Procaine. It's strong. Can you get up and walk to the door, please?
We'll find out. If I get lost, will you please throw breadcrumbs?
Yeah. We'll have a yellow brick road for you.
Oh, markedly different. That is freaking amazing. I don't know how you do that. You're really brilliant.
You're kind. Come to me. Come to me. You're walking different. Definitely. Now go to the door.
He's trying to test my hearing.
Is there any pain left?
Yeah, but you know, that's okay.
How much better is it?
Probably 60% better.
Okay, lay down. Okay, so we're going to check that. We're going to check number one. So let's check the strength of this before you touch it.
Okay. That's the back
Yes.
top.
Right. Not yet.
Okay.
Hold. Good. Now touch it. Okay. Hold. I'm going to take my baby finger. Hold. Baby finger. Look at that. Okay. That's got to tell you something. My baby finger can break your arm. Okay. And we're going to inject that. You can keep it running.
Okay.
Open up. Okay. Touch that, please. Hold. Do it again. Hold. Come on. Would you agree that I laid into you? I put my weight into you. If I had done that with my finger, I'd rip my finger off at this point. Okay? So at this point, I will take that. And you can sit over there. Terry, please get up and walk to the door.
I'm going to have this memorized pretty soon. It's hard. Amazing. You're amazing, Doc.
What's going on now?
I don't know. Yeah, shoot me in the mouth and my leg works. Come on.
Who would believe it if they didn't see it?
Yeah.
Right?
Yeah. Yeah.
Walk to the door and back. And then I'll have you sit down on the chair. All right, on a scale of 10, if you came in here with 10 points of pain, how much pain do you have now?
Okay. I'm not going to do a baseline of 10 because I'm not crying, etc. So it's 8.5 that's my high baseline.
Okay.
It's probably 4.5.
Okay. So we've cut it in half, about, right?
Yeah.
Just working in your mouth.
Yeah.
And you're walking and it was greatly relieved.
Yes.
All right. And I showed you last week. Did we video it last week?
Yes.
Yeah, I showed you that it's related to the sacroiliac joint,
yes.
right? At least one of them
yes.
is. And the tooth number 18, the root canal, that's related to L4, L5
okay.
lumbar, okay?
Okay.
All make sense to you?
Yeah.
Okay. You want to do something about it?
Sure.
Okay. To me, right now, it's in the dentist's hands more than mine. So I'm willing to go ahead and do a local injection because you're here and you came a long ways. But I don't want to shoot your back again until you get those dental issues resolved.
Addressed.
Am I making sense?
Yes. And I think that's kind of where my wife and I felt we were last time.
Okay.
So, but you've made your point. So,
Thank you. May I post this on YouTube?
you may.
Thank you. I'm going to stand corrected. I just did another muscle test on you, asking your body, should we even do your sacroiliac joints and your body said no.
Okay.
All right?
And I'm comfortable with that.
Okay.
We have a homework assignment.
We have a homework assignment. It tells me your body's saying, don't mess with my sacroiliac joints until pressing issues that could be affecting it are taken care of. You all right with that?
Yeah.
All right, good. Thank you. All right, you were just telling me about moving around and coming from your car, etc.
Right. When we arrived, I was using the crutches. We parked probably 25 yards away. And I had to stop and rest with the crutches. I mean, I already walked farther 4 times already in here than I did out there.
Wow, that's pretty good.
Yeah,
okay.
it's really good.
So go to the door, please. And come on back. And your shy wife just told me that you are walking dramatically better.
Yeah, the problem is she doesn't lie.
Okay, you are walking dramatically better. I'm pleased.
Absolutely.
So that's all we're going to do. Thanks.
Fine.